Yeah. The health advice we received from Dr Chant, and allow Dr Chant to make further comment, is that we have an obligation on behalf of the nation to contain the virus. If we don't contain the virus, there is critical work that goes on between states. No matter how hard you have a state border lockdown, the virus still seeps through. No border is perfect. There are always exceptions. And that's the point we want to make. That's the point we've made in New South Wales from the start of the pandemic. No matter how hard you make your border closure, it doesn't prevent, with the exception of WA, which is very segregated from the rest of the nation, it is very difficult to contain the virus within any boundary because there's critical work, there's distribution, there are compassionate grounds where you have to allow family members, especially when there's a very serious family situation, to move around. So it is a national emergency based on the advice of Dr Chant, because unless we contain the virus, not only will we have a challenge in opening up parts of our economy that we want to open up in terms of allowing our nation to function the way that it can, we need all hands on deck in terms of refocusing our national vaccination strategy. And we know that in some places around Australia, there is 0 to very few cases or 0 cases. We need to get at least the first jab for as many people as we can in those affected communities as possible. And that's why we're asking for a refocus of the national vaccination strategy. We've already put some requests in, which we understand are being considered, but we need a refocus. That means using all vaccines available, including the AstraZeneca. I've had the AstraZeneca jab. The Chief Medical Officer, Dr Chant, has. Minister Hazzard has. My parents have. The AstraZeneca is a very, very effective vaccine. So we are redoubling our efforts in using up the supplies of AstraZeneca that we have, but we also have to acknowledge there is a much younger population in those affected communities, and we need to also refocus the national vaccination strategy to getting at least one jab, the first jab of Pfizer in some of those demographic cohorts, to prevent the spread. Because no matter what we do, no matter what extent of restrictions you put in place, there are people that make sure the rest of us are safe, have food, have the items that we need, and they need to be able to continue to work.